It's not the usual conversation we toast to at the holidays, but Renee Mahaffey-Harris of the Center for Closing the Health Gap says,
the more we know about our family history, the greater likelihood that we are going to be able to take preventative steps sooner rather than later.
And those preventative steps change outcomes for long-term illnesses such as heart disease that build up over time. You need to go back at least 3 generations if possible, she says, to really learn your risks. And here's why.
Within the Black community in particular, Black people in particular, from a disease perspective, we're seeing onsets of diseases that are normally showing up in your older ages under the age of 50.
The Centers for Disease Control and Prevention has this family health history checklist if you need a guide to help this conversation. Step 1 tells you who to talk to in your family if possible. Step 2 tells you which chronic illnesses to ask about. Step 3 provides a tool from the Surgeon General to create a family health portrait. And Step 4 tells you who might also benefit from you sharing your information, especially younger family members.
You see earlier onsets of type 2 diabetes. You're seeing an alarming statistic of increased percentages of young people under the age of 18 being diagnosed with type 2 diabetes, as well as hypertension.
Finally, the CDC recommends you act on what you learn. Your primary care doctor can help you with the next steps, and we have this checklist for you inside this story online.
Thanks for checking out Local 12's YouTube channel. Click the links and hit subscribe so you can be notified anytime we post new stories.